Hi everyone, thank you for joining us today. My name is Valeria Flores and I'm part of the MHPSS.net team. We're very happy to host today's webinar, Integrating MHPSS and Peacebuilding, Mapping and Recommendations for Practitioners, Key Messages from Iraq. Before we start, and while we wait for more people to join us, can I ask you to please introduce yourself using the chat? Let us know where you're connecting from. In addition, please remember that we have interpretation options today, so you can choose the preferred language you would like to listen to this webinar. You can select between English and Arabic. As well, during the webinar, please use the chat function to ask questions to the panelists. We'll be sharing them with the moderator and the presenters. This webinar is also being recorded and will be posted soon on all our media channels. Welcome, everyone.
Hello, everyone. Dear ladies and gentlemen here and our dear colleagues on Zoom, we would like to welcome you for the activity of today, which is entitled Integrating MHPSS and Peacebuilding, a mapping and recommendation for practitioners and key messages from Iraq. Thank you very much for your attendance. My name is Reem Jodin. I'm from the MHPSS program. I work with IOM Iraq. Today's discussion is going to be dedicated for the discussions and recommendations that resulted from the IASC, and this report shed light on the intersections of the psychological health and the social welfare and the efforts of the sustainable peace building. Today's discussion is going to be detailed on integrating MHPSS and the initiatives of peace building. This includes the impact of integration on the capacity of individuals to resilience and recovery and the stability on the affected communities. Today, we have a group of speakers and a group of participants in a webinar that they are going to discuss their expertise and their knowledge in this topic, and also they will share the best practices and the orientation related to the field of the integration of the MHPSS and peace building. We would like to welcome you again, and I would like to thank you because your presence here is important and an indication for the importance of this event and also your interest to discover this field more. Now we will be with the delivery speech and the opening speech by the director of the IOM in Iraq, Dr. Yoko Fuchima. The floor is yours.
Representatives from the Ministry of Health in Baghdad, Ahlan wa sahlan, and also the partners, practitioners from the federal side, Ahlan wa sahlan. Also representatives from Ministry of Health in the Kurdistan region of Iraq, Zozor Bahirven, Varizan, and also the practitioners as well. We are launching the IASC, the guidance note integrating mental health and psychosocial support and peace building today. And then this is the second launch that I've heard in the world, followed by Colombia. And I would like to, sorry, I'm too short. I would like us to take back a little bit in the past. So I was told in 2022, the UN Secretary General reported on disarmament, demobilization, and the reintegration, highlighted that this process needs to include mental health and psychosocial support by providing adequate and effective mental health and other community-based needs for all conflict-affected communities. So I also remembered the fact, maybe some of you remember 2004, there was a big tsunami in Indonesia and the Pacific region. Anyone remember? Right after that, because that region had the war for over 20 years, and then right after the tsunami, they signed a peace agreement, meaning that there was a need to reintegrate the former combatants who spent, the decades in the mountain. Yeah, that time I was engaged in this reintegration, disarmament, demobilization, and reintegration support. And then I remember there was no mental health and psychosocial support. I don't remember that I heard that this was considered during the process. So I'm really happy to see that both of them are connected. And also this launch of the guidance note in Iraq is a testament for all the commitments you have made and you are still. So that, our hope is that peace building component and the mental health and then psychosocial support are interlinked and also influence one another, meaning they're equal. The collaborative effort to address the needs of individuals and communities impacted by wars and crises and other forms of violence promotes a whole of society approach to peace building. So as you know, in Iraq, we have witnessed a lot of displacement because of the war. And then nowadays, we also see a little bit of displacement because of the climate change. I wouldn't say because of that, but we all know that the demand to access the mental health and psychosocial support in Iraq is very high, right? But we are still fighting against taboos and prejudices as well. Because I am also coming from the area where I don't want to openly say that I need the support. But this is, with your support and an tireless effort, we will be able to make it. This is just, anyone has a right and it's okay to seek support. And I was also told that IOM, together with the Catholic Relief Services, that we have worked really well and prepared tirelessly for this event. So I would like to say a big thank you to my colleague from IOM, but also from the CRS side. So I have mentioned about the needs of mental health and psychosocial support, as well as a peace building in the context of post-war. But also under the development needs, there is a need, right, to promote the importance of mental health and then psychosocial support. And then today we are launching this guideline. Guidelines, Heidi told me it's 200 pages. You can read. Sure. But it's like a textbook, remember in a school time. Or maybe let's say my sister is a nurse. She had to read lots of books, right? But then she had to adapt it into a practical way. So that was maybe perhaps missing. And then maybe that's why we're working on it. And I see the importance of translating the text, all what, the information you get from books or written materials into action is very important. And then because you're already working on it, I am proud of all of you today. And not just today, but it's always. So I mentioned about the development needs, yes? So in line with the Sustainable Development Goals, I hope you all know about SDGs. So there are lots of goals, but for instance, goal 3, 16, 17 concerns good health and well-being for all, peace, justice, and strong institutions, and promoting partnerships. So if we work together, and we continue to work together, all of us are contributing to these goals under the Sustainable Development Goals. And mental health and psychosocial support and peace building are likely to have a greater positive effect than one working on itself. So it's a collective duty that necessitates active participation and a collaboration from all, including our government partners, healthcare providers, community leaders, and also key change agents, educators, and also the citizens themselves. Last I would like to invite all of you, especially the practitioners, to think about how we can adapt this guideline at the global level into Iraqi local context. I think that will be a really exciting exercise, and I'm sure you will be able to achieve that. So I would like to encourage all of you to work on that. And then most importantly, please enjoy the launch today. Thank you.
Thank you very much, Yoko. Before to start the discussion of the ISAC, as far as concerned the integrating of the MHPSS and peace building, it is important to start with a comprehensive review of the context and the current situation in Iraq. So we will receive Dr. Bashar Amr Abdul Majid, the director of the program of Al Tadamun League Iraqi, and also he will found a basis for the discussion of how to implement the recommendation of the report within the current context of Iraq. Dr. Bashar, the floor is yours. I would like to thank IOM. Within the context of Iraq, I will speak with very broad lines because the Iraqi context needs years to talk about the dynamics that works and exists inside this context. But as a broad and headlines, I will speak about the Iraqi perspective from two perspectives. The first perspective is going to be dedicated on how the Iraqi context with its civilization, which extends to long distant years, and how these civilizations communicated with other civilizations. Iraq is provided to the Middle East justice system, ancient justice systems, many laws that have been based on it. And if we look to these social systems, they are considered as fair laws. And Iraq, with this civilization, with this human message that has been delivered to the world, with its secularity that Iraq is focusing, is related to the diversity, the wealth, and also the culture and the diversity based on religion, nationality, and many diversities that have been tackled by social workers. As far as concern the Iraqi dynamics issue, it was a bit complex related to the Iraqi society because Iraq have been through different phases, which led that the individuals, communities inside the Iraqi societies have witnessed many fluctuation as far as concerned as the psychological situation due to the war. If we look to the modern side, we can see the Iraqi Iranian war and the first Gulf War and the American also war and also the tensions that happened after 2003 till we reached 2014. This put Iraq and the Iraqi society with different fluctuations that can make the Iraqi citizen how to manage himself and how to manage his psychology with others. When we reach the outrage war by the ISIS, we speak about a social trauma within the Iraqi context after the conquering of 16% of Iraq from north and middle of Iraq. And of course, this resulted, as you may know, what are the outcomes that war has resulted, not only as far as concern the infrastructure and the murder of people, but also there are three main elements for the individual and how to participate to build a community and how the easy to have an access to these services and also how to manage the chain of the relations within the Iraq community. This all is due to the first line of the influence of war with ISIS. So the MHPSS and peace building, they are interrelated concepts. If we check them or if we see them independently, we will influence the balance, as we say, figuratively speaking, within the concept of the international human rights law. So when we speak on the impacts of war with ISIS, we speak about the deterioration of mental health and also the positive, and also the mental health is a management. So this management between this diversity of cultural and national and all the diversity of Iraq, it led that individuals become to have a problem with the management of situations which requires from the peace building and the group work. Also, we had devastating stories and emotional stories when we speak about the agony and the pain, and we speak on the deepest things that is stored inside the emotional side to get rid of these devastating stories, which has led in many interviews with women from Al-Hol camp. They speak about devastating stories. Even the interviewer is going to be affected by these stories, and he may need this personal influence in this regard. International law, international humanitarian law is represented by international instruments that's signed by Iraq, and these instruments and these charters to have and to face the government to program to face a clash with the human rights, with its complexity, and how to deal with these social complexities which threatened the society in two ways. The first way, we had a social or a society of stigma, which means that a stigma or somebody who have been suffering from trauma, and sometimes the stigma and the trauma are interconnected in this regard. And another part is related to the fabric of the community and the social harmony and the degradation as far as concerned the tribal side and the civil side and civilization side, and the family interconnection with all its naming has been detected and influenced that in this time. This led the communities in all Iraq that there is a fuzzy line or a vague area that is not clear from the perspective of the Iraqi citizen youth, considering that one of the wealth of the Iraq country, Iraq is considered one of the countries who have over 60% of youth. So it is a young state, it's a young country. So as a consequence, the concept and the youth ideology of the Iraqi society has been threatened by a clear future to the youth. So we can see, and we have recorded on the local level and the international level, a suicide activities, and this is a very alarming state and a red flag as far as concerned the psychological health. When we speak about the challenges within the Iraqi context, it is complex, but we can summarize them with a very broad lines. The first one is related to the social infrastructure and how the social infrastructure or structures have the ability to participate in peace building. And one of the challenges also is related to the mechanism of return, because the context of the returnees for individuals to their original places and even within the host communities, they are suffering from all the concepts of the social cohesion and the citizenship and the concepts of the integration among the host communities. And this is reflected to the basic services that these communities have. They are stigmatized, they are shocked, and there are communities which they are basically suffering from the fragile of the social cohesion. As a consequence, these broad lines, if we delve into more details, we are speaking about two types or three types of communities. One of them are the affected communities and their request of social justice. And also, it's the first line of the transitional justice or the reconciliation justice. So these lines are obstacles and difficult challenges for each program or an intervention strategies that should take into consideration. When we speak about stigma and marginalization, we speak about listening to the request and the voices of the affected families. When we speak about stigma, we speak about families who are stigmatized, that we have the perceived affiliation, and also the most complex part of this situation that most of these families are from women and children. So the social values within the perspective.
So in the Iraqi context and international context, then we should reconsider these issues and then and also so that we can improve more than one ideology and one way of thinking and comprehend so that we can comprehend all these difficulties and obstacles. When we talk about the stigma and when we talk about documentation, so the official document here in the present time for those families who return to their communities, and 90% of those family members do not have documents, and this is rooting. In fact, this is aggravating this problem and this stigma. So here the MHPSS, it's also it's a new and fresh concept. It's not known to most women. So here, consequently, so this concept for and supporting these communities, sometimes the communities reject this concept because they do not understand it, they do not comprehend it, receive it as the way it is. Most of the geographical areas, they just sometimes do not have the ability to comprehend this. And also the specialists in MHPSS, are few, and this also adds insult to injury, adds to these difficulties and children challenges. Also, we have the economic aspect and the economic field, and then also the government program, and how to deal with the complicated, with the vulnerable communities, which are witnessing an increase in unemployment. So here within the Iraqi context, it's it is trying to endorse and trying to embrace all the programs concerned with this. One of the aspects that is here, for example, the Iraqi government is striving to close those IDP camps, and that's why here this is an indication that Iraq is transferring to recovery stage. So this is an indication also that the Iraqi government and the programs that they adopt now, they are endorsing new guidelines and new ideologies and new strategies in order to face these difficulties. And also the communities who receives these families, also they have learned how to stand, to show resilience, and how to support and to communicate and to peacefully coexist with those stigmatized families. Some of the families, they have adopted to the cause of these and to the needs of those families. And so much research has been done on this, and so the psychological aspects and has been done on the psychological issues and in terms of communities and individuals, and there are so many questions answered by this research. And also here I and so many people just like me, we think that a war and conflict affects on the three concepts: the mental health, MHPSS, and the peace building. So if we just segregate, or we deal with these three aspects and the concepts individually and separately, this will lead to consequences. And so also here we're trying to focus on the positive management with the communication or with the others. That's why the conflict management, and also here we just need also to take into consideration the conflict circle and also the consequences of conflicts. So here we need also to focus on the positive impacts of the programs that that can be conducted after after the conflicts and wars that can maintain sustainable peace building. So also we talked about, so that we also there is one talk about the unjust and unfair about those families and vulnerable families. And then also we have the international and local events and activities that can address those needs and also those unjust and unfair condition and cases that those vulnerable families. Thank you very much for giving me those few minutes that are these to talk about these general guidelines. Thank you very much. Thank you, Dr. Bashar, for this comprehensive overview on the concern and for the integration of MHPSS with the peaceful. I would like to just highlight that would present the interagencies by Isaac report on the integration of integrate MHPSS and Peacebuilding. She's in charge of the MHPSS in the main office of IOM, and also she has a wider experience in the field of MHPSS and recovery and peace building. Please, the floor is yours.
Thanks a lot, Reem, for the introduction, and good afternoon to everyone here in the room and also online. Thanks for joining us today. I have the pleasure and the honor to there were several processes ongoing over the last years trying to conceptualize the for a long time. But I think it's more conceptualized, or being more conceptualized over the last years. Like in 2020, there was a review of the UN peacebuilding architecture, and a task force for MHPSS from the Ministry of Foreign Affairs from the Netherlands has really come up with some concrete recommendations on how to do that, and making more advocacy for the integration, and asking people to exchange more between practitioners, MHPSS, as well as peace builders, to do more capacity building, increase knowledge around how to actually implement this integration. And in that context, in 2019 already, the IEC thematic working group on peace building has reconvened and decided to support this effort. It was first co-chaired by UNFPA and GIZ, and currently it's co-chaired by IOM and CRS. And it was this group, it's around 25 different organizations now part of that group, that really has pushed to put this guidance note together. So the purpose is of the guidance, as I said, was to conceptualize further things that are out there already, and to make them known to people, and to give them and provide some language around that. So to enable and enrich the integration of MHPSS and peace building, not only in the post-conflict settings, but also humanitarian and development. So because we see this as a continuum. and to describe the current state of work and to develop specific principles out of what we know is out there already, and identify the challenges of integration. The report is really understood as a result of a co-learning process. And this is also what, whenever we talk about it, we want to invite people. And it was mentioned here earlier, here in Iraq, this co-learning, like this event today is a good opportunity to foster this co-learning process, meaning exchanging on different perspectives, because it's a very interdisciplinary process. I think this is no longer working. Can someone help me with getting to the next slide? Thank you. Yeah, so how was it done? In 2021, the thematic working group on peace building has decided to develop a knowledge report or knowledge product. So it was a consultancy process that involved a global survey. So a lot of people were asked, what do you know about integration? How do you use it in your work? What would you like to learn, like as an MHPSS practitioner, about the peace building side and vice versa? And that was really a global survey done by the consultants that actually also was later used to feed into the guidance, with a lot of examples. For those who didn't have a chance to look at it, indeed is a 200 pages document, but half of it is really case studies from different countries and from different projects that can inspire you in your work. And the second piece of the consultancy was consultations with young people, with policy and thought leaders, as well as grassroots organizations. And I will come back to that later, why this was so important. 28 countries participated in that process. That has, led to the report that we now have in front of us. So just to give you a brief introduction on how it looks like, there are 3 sections. There's the overview, then a chapter on towards integration, and then towards the future of integration. So for those of you who don't have a lot of time, just read the overview, because it includes the executive summary and also the background of the report, and gives you some initial ideas on what the main findings were. The second, maybe go back, to the second piece was towards integration, is really highlighting the different program case studies and country case studies. Like there are 5 country case studies from Colombia, Philippines, South Sudan, and Sri Lanka and Syria that highlight different contexts of conflict and post-conflict settings. And as I said, also highlight best practices that people can use when working towards more integration. So why do we integrate? I think I have not much to add to what we just heard. I think there was a lot of good examples already from the Iraqi context, saying why is it important to stop those cycles of violence, and to provide MHPSS to people affected by conflict, by displacement, etc. And at all levels, it really concerns often the whole society, like depending on different vulnerabilities we see on the ground. And there is evidence on the importance or the usefulness of integrating MHPSS and peace building. So there is evidence in terms of that we can see that it can help to not only deal with the psychological and social impacts of exposure to violence, but also to break those cycles at community level, at family level, but also society level. I think we really have to think through all the different levels, the socio-ecological levels. So we think, and as I'm repeating what was said earlier, that it is more fruitful to do this together and not separately from each other. And of course, the integration can help to deal with do no harm issues and to be conflict sensitive. We are seeing a lot of similarities between the 2 fields, but then the work on integration and what is documented is not that large. So we are hoping that with this guidance note, we're contributing to the discussion. And because the two fields have developed differently, yeah, and there were some challenges in integration because MHPSS tends to look more at the individual, maybe the peace building side looks more into other processes, linkage to not only community but also governmental structures. Maybe also the peace building side is seen as more political, and MHPSS tended in general to be less political or trying to be neutral, not going into that space. There was lack of material on how to operationalize. I think that's a big thing. We know about it, but we don't know how to put it into words. And of course, lack of also funding and to nurture those collaborations and partnerships. So some key learnings from the report. First of all, there's very different types of levels of integration. So as I said earlier, some concern the different socio-ecological levels, so talking about the individual, family, community, and society levels, and how this work can be done across those levels. So some have used this kind of a typology to describe the level of integration. From the MHPSS side as well, practitioners have described how they integrate across the 4 layers of the intervention pyramids that a lot of MHPSS practitioners know. And then also the intensity of integration. I will show you later what has been suggested in the report. There were a lot of different topics that came out of the survey. So people working not only on the psychological and social impact of war and conflict, but also truth-telling, working with GBV survivors, dealing with gender inequality, supporting livelihoods. So you see a lot of examples here, preventing violent extremism. So it is a large field. Yeah, we cannot be expert in all of these topics, but you see it needs lots of people to come together to contribute to that conversation because not one person can do it alone. And another thing that came out that was interesting was actually the entry points. So sometimes integration is done when the community has identified an issue and then they want to deal with it and they come together to deal with it together in an interdisciplinary way. Sometimes programs use approaches that they have already in place, like health, education, and they integrate through the... All right, I think we're back on track. Sorry for this little interruption. I hope the power stays with us for the continuation of the conversation. So yeah, I was talking about the different entry points, how things are mainstreamed into different sectors, like including education, health. That was also an outcome of the survey. And that, of course, building on specific MHPSS component that have been included in peace building work already. Maybe we can go to the next slide. As I said earlier, I think what is very special to this guidance is that it has a focus on grassroots, as I said. And that's for a specific reason. A lot of this work on integration is actually has been done for decades. Yeah, you see that across the globe by grassroots organizations, women's organizations, and they wouldn't talk about peace building or MHPSS because those are terms that, especially MHPSS, didn't exist before. Yeah, it's a term that has been created over time. And even peace building, yeah, people would maybe say, yeah, we do something so that people can better communicate with each other. We want to improve relationships between community members, etc. So they wouldn't talk about MHPSS and peace building, but they can inform what we do and they can inform the processes we want to maybe scale up even to the national level. We can learn a lot from those different communities. And here are the 4 groups that are specifically highlight women and girls, men and boys as a specific group to contribute to maybe a specific negative effects at community level, but also young people. A lot of this field is actually, we heard here, 60% of young people, like bringing in young people into decision-making processes, making them participate into rebuilding societies is a very important aspect when we talk about integration of MHPSS and peacebuilding. The whole guidance is has a lot of guiding questions that you can use to actually reflect on your current practice. Maybe you can go to the next slide. So for the levels of integration, we are suggesting this visualization. Again, I can ask you if you as an organization would like to see, are we actually working in an integrative way or not? You can look at this visualization. So because integration can happen at all those levels, programming, operational, inter-organizational, and conceptualization. And often at the beginning, those things are really not connected. Yeah, so we talk about the different levels, and the idea of integration is making it more linked to each other, and to start from the beginning to talk about how we integrate different areas from the MHPSS and peacebuilding side. So it's an invitation to you to maybe check where are you standing in terms of integration. And again, the guidance has those questions that will help you to and take you through this self-reflection. Another aspect that came out, and I mentioned earlier, we're really not just talking about integrating MHPSS and peacebuilding principles in the post-conflict setting. The humanitarian development peace nexus is a terminology that has been used over the last years, but it really also applies here in that context that a lot can be done across the different phases of conflict, even before in terms of prevention. So that's a very important aspect now, but also in terms of development sectors. So we should think about how we use those integrative approaches in the different conflict phases to make sure we are actually efficient and we are prepared for an eventual new outbreak of violence. And I think this, I'm just taking the example of violence. There are many others that we're looking into. But yeah, it's useful to think about how we do that differently in the different phases and how we adapt our programming to the different phases. So the last two slides on the guidance, yeah, the vision is really bi-directional integration. So that's I think something that is new and special to this report, that there's really an emphasis on bi-directional integration. So it's before, mainly what we see in practice is that MHPSS is integrated into peacebuilding. And what we would like to encourage here with the report is to say peacebuilding needs also to be integrated into MHPSS, including training on conflict sensitivity, see what MHPSS practitioners can do to deal with, let's say, small scale conflict transformation in communities, et cetera, et cetera. So I think we're still at the beginning. There's more knowledge about this one-sided integration, but that's what we are looking into to promote. And to really, as I said, connect the different ecological levels. You will see other elements. A second one I think that is important is the holistic integration. So not just do it standalone, but across the different sectors that we think are relevant, because MHPSS cannot stand on its own, but it needs to be connected to other areas of services. And as I said earlier, we have to think through the whole process of conflict when integrating. So the recommendations are, those are just a few for the donor and policymakers, but there are many more in the guidance. Of course, we want to use this guidance also to create more awareness on the need of integration of MHPSS and peacebuilding. And to invite donors and policymakers to consider that we need long-term processes when it comes to integration. I mean, we cannot achieve peace, sustainable peace in a short period of time. And the same for MHPSS and the promotion of well-being at the individual and community level. It takes time. So we need to advocate for more programs that are longer term, more funding in the longer run, that is flexible also, because you see also in Iraq, the situation can change and we need to be able to respond to the changing environment. So we need more dedicated funding for the integration of MHPSS and Peacebuilding. And part of what we do today, as I said, is we need to strengthen and learn from each other to really promote this process. So as I said earlier, you can either read the overview if you don't want to look into 200 pages. If not, we also have produced this policy brief. It's an accompanying document that is also online, and that's much shorter, and it has those recommendations. So for those who want to just read the short version, I invite you to consult it. It's on the IASC website, and it has this condensed content that I just presented here that might be helpful and useful. And if someone is asking you, okay, what does it mean, integration? What are the principles? Just guide them also to that document, and you can use it for your own advocacy in that field. Thanks so much for your attention. Apologies again for the little rupture earlier, and I'm looking forward to continuation of the conversation with you here in the room and also online audience. Thank you.
Thank you very much, Haida, for presenting the report and also elaboration of the different aspects of the report and how to implement it in different contexts. Now we are going to be with a key message for a video with the Reverend Priest Raed, the head of the Catholic churches, and also the bishop and also the bishopship of the Syrian Catholic. With this message, Father Raed is going to talk about the importance of peace and social cohesion and the recovery of communities and its improvement. His message is going to focus on the vital role that each individual of the community can play in order to make communities more coherent and more cohesion.
غادرنا المدينة كطائفة مسيحية وأنا كرجل دين مسيحي. غادرت المدينة إلى إقليم كردستان بعد أن احتلت عصابات داعش الإرهابية المدينة. مباشرة بعد تحرير المدينة عدت إلى الموصل، إلى كنائسي، إلى مدينتي التي ولدت فيها، وعملت على أن تعود الحياة مرة أخرى إلى هذه المدينة العريقة. كل الكنائس في مدينة الموصل كانت مدمرة. عملنا على إصلاح وترميم وبناء بعض الكنائس، وهذه الكنيسة هي كانت البادرة أو الكنيسة الأولى التي من خلالها باشرت بمهام عملي بعد أن عمرت وصارت مثل ما تلاحظون أمامكم. لكي ما تكون بالحقيقة حياتنا ليست عبارة عن أقوال فقط لكن أفعال أيضا. نسعى ككنيسة وسعيت إلى أن يكون هناك إلى إنشاء مؤسسة تحمل هذا الفكر وتبث هذا الفكر، وبالفعل قمنا بإنشاء مؤسسة الخيمة للتنمية وبناء السلام، لكي ما نستطيع من خلال هذه المؤسسة أن يكون هناك بناء فعلي للإنسان على الصعيد الروحي والنفسي، تنشئة وتهيئة لفئات معينة وشرائح معينة من المجتمع تؤهل وتنشأ لكي ما تبث تلك الروحية أيضا في مجتمعاتها ومريديها. قمنا بإنشاء هذه المؤسسة التي هي تحمل اسم الخيمة، والخيمة مثل ما نعرف هي تحمل كل المكونات، يجلس في كنفها كل المكونات. هذه هي الفكرة. قمنا بهذه المؤسسة ونحن كمؤسسة ناشئة بالحقيقة نطمح إلى التعامل مع كل من له باع طويل في هذه الأفكار على الصعيد السلم المجتمعي والصحة النفسية والروحية والعقلية. أعيدها مرة أخرى، قمنا بإنشاء هذه المؤسسة لكي ما يكون هناك أفعال مع الأقوال من أجل صحة هذا المجتمع الذي نعيش فيه، الموصل حبيبتنا والمدينة التي تربينا ونشأنا وترعرعنا فيها. مجتمع الموصل مجتمع ديني إن صح التعبير. اليوم هناك تأثير كبير لرجل الدين في مدينة الموصل في التأثير في مجتمعه. يجب أن يكون هذا رجل الدين يتحلى بأخلاق خاصة، بفكر خاص، بثقافة خاصة، لأنه هو بالفعل مؤثر تأثير كبير في مجتمعه، في مريديه، في من يستمع له. لذلك يجب أن يكون هناك في الجهات الناشطة المحلية، إن كان على صعيد رجال الدين أو كصعيد أكاديميين في المدينة، عليهم أن بالفعل أن يبثوا يتثقفوا أولا بثقافة واسعة، ثقافة إنسانية عميقة، إنسانية أولا قبل أن يكون أي شيء آخر، لكي ما يستطيعوا أن يغيروا ويبثوا روح السلم المجتمعي والتعايش السلمي في كل من يسمعهم، وبالنتيجة في المدينة، في الواقع الاجتماعي في المدينة بصورة عامة.
So from the video message that has been taped, now we will move to the seminar and the panelists who are going to participate within their expertise and their practical experience and knowledge in the field of the integration of the MHPSS and peace building. Today we are having Dr. Shayma Salahuddin from Iraqi Ministry of Health, and Dr. Abbas Nazar from IHOW organization, and Ms. Kawthar Al-Muhammadi from Suqya organization for relief, and also Rayan Muhammad Faraj from the GIZ. Most welcome all of you, dear ladies and gentlemen. At the beginning of discussion, I would like to request from you to introduce yourself to attendees and also to describe the context that you are working at the moment, and also to give us where are the locations of the integration of the MHPSS and the peace building. We will start with Dr. Shayma. Thank you very much for all attendees, and thank you for hosting me. My name is Dr. Shayma Salahuddin, the Director of the Human Rights and Women Empowerment at Ministry of Health, and also the Officer of the IDPs since 2014. Since the ISIS events and the falling of different governorates under the control of ISIS, we had a huge experience in cooperation with the Kurdistan regional government, and also opening new camps and opening health centers for IDPs that were there. They were moreover than 6 million, and the number was a huge, who were suffering from displacement, murder, and rape, especially the Yazidi and Christian components and other components like the Shebek component of the Iraqi society. Honestly, Ministry of Health were mainly focusing on providing medical services and providing medications and physicians and medical staff at that time. We had honestly something that were very prominent in order to uplift the social health programs for the victims of ISIS, especially of what they have of sexual violence and rape and different forms of violence of different categories at that time. Honestly, after that time, we have opened the Department of Women Empowerment and Human Rights by a decision of the Council of Ministers of the year of 2021. The task was to implement the second national plan that Iraq has endorsed by the Security Council resolutions of 1325, which is focusing on the agenda of women, peace, and security. We had more than 14 activities related to Ministry of Health. We have worked with leaders at the Ministry of Health and also with the KRG government and the psychological unit and also the Directorate of Health, Psychological Health Directorate to implement these programs and how to develop them in coordination and cooperation with international organization and government institutions. Thank you very much. Thank you, Dr. Shema, Dr. Abbas. Good afternoon, everyone. My name is Dr. Abbas Nazar, Director with the IHOA program. The IHOA program is a local organization. It has been established back in 2008 and it has been worked in more than 10 Iraqi governorates so far. We have worked in different sectors like education, health, protection, shelters, and not to mention others. Also, IHAO sees that there is a great importance to speak about the social determinants, which consider psychological health and peace building is one of the basic milestones. So that's why we are focusing on integrating these services through the work with different and multi-sectors. Also, IHAO works and receive local communities and IDPs with a focus on women and girls in addition to the children with disabilities. Thank you very much. Thank you, Dr. Abbas. Ms. Kauthar. My name is Kauthar Muhyiddin, Chairman of Siqia Organization for Relief and Development. As Siqia Organization, it has been established back in 2017 for the returnees and IDPs in the camps in Anbar Governorate. And then in 2021, we have been established directly by the General Secretary of the Council of Ministers. We have worked on different projects in psychological support and also safety and also economic empowerment and also on different activities on youth, women, but we have mainly focused on women and returnees. And at the moment, now we are focusing on Al Jada'a. As Suqya, it is led by women and also to include women within the activities and the initiatives and also with youth that to have within the workshops and also within the trainings and any activities to have activities related to psychological health, especially women. For example, they have the landmarks of trauma and isolation because today Suqya organization started its 9th project with international organization in Anbar Governorate. Thank you very much, Ms. Kauthar, Mr. Marwan. Thank you very much, Taysir. I would like to welcome everyone and attendees. My name is Marwan Mohammed. I'm a clinical psychologist. I've been working for 10 years in the field and the programs of psychological support in the MHPSS. And at the moment, I'm working in the program of the civil peace survivors. It is part of GIZ work. And since 2017, after the events, GIZ and CSP start to work in the areas of the post-trauma conflicts and how to help communities to recover. At the moment and since 2017 so far, SPS working on 3 main topics. The first one is related to the MHPSS and also we are focusing on the help of the communities to deal with the impacts and the results that have been led by the impacts of the psychological side. The second topic that we are working on is represented by the transitional justice, and it means that to provide elements and tools for the local community to find suitable ways to deal with issues that is related to the social justice. And most well-known our partners is the UNITAD. And this committee is working on collecting and investigating on cases that happened for the male and female survivors and civil society as well. And then it is shifted into a legal framework. And then it is institutionalized, and also it helps male and female survivors and the civil society as well to find legal methods to deal with these cases and also to feel the transitional justice. And also, this will help, and this is the part related to the MHPSS and peace building, because this process will give in this regard, and it will prevent many negative issues that comes after or post conflict, which is revenge, and to prevent these events to be repeated again. The second topic that CPS is working on is the social cohesion. Also, it is to the recovery of the social network that has been affected by conflicts and what has been resulted by these conflicts. Thank you very much indeed.
Thank you very much, Mr. Marwan. Abdullah. I would like to thank you all for being here. So it's starting from the Iraqi context. Now I would like you to what are the interventions that we can utilize in order to integrate MHPSS with the peace building within this Iraqi context. And starting from the experience in dealing with in working within the Iraqi context. So we think that the sectors of that the highly potential sectors of that the target the services that target the climate changes, but because these climate changes have a detrimental effects upon the lives of the families in terms of livelihoods and and also sometimes these effects provide a force these families to be displaced or to leave their areas, which also adds burden to those families and on the housing communities. Also, the displacement and the IDPs, and most of them have been subjected to violence and also have been used or have been physically abused. So that's why integration of those vulnerable families and also is one of the focus of the points that we can use in this as an intervention. Also, the inclusion of health services. Health services are very important to the vulnerable communities. However, this idea, this inclusion or integration is still new and has still been not addressed properly or as it's supposed to be by relevant authorities. And in order to integrate to a complete spectrum or complete group of health services, just to work together. Thank you, Mr. Abisson. Also, the addition, also those sectors that you have mentioned, including this displacement because of the tribal conflicts or the climate changes, and the challenges that this displacement has imposed upon the within the Iraqi context. A very important points, Dr. Mutana, please. Would you do so within your experience, and of course when you work with women and you work within the health sector, so what do you have to say to add in this? Thank you very much for so in order to complete and to continue on what my colleague said, the Ministry of Health and the Iraqi government have adopted the programs of to provide MHPSS services through the strategies. It's just the national plan for the agenda for women and peace. So here our role in this agenda is how to present present the MHPSS programs and the health of mental health programs to vulnerable families and vulnerable communities in order to reach this peace building. So the government has adopted the counter-terrorism, the counter violence practices against women, and also we talked a lot about these the MHPSS programs, also the strategic national the national strategic policy strategy in terms of the women empowerment, the social empowerment, and the economic empowerment of women. So most of those strategies focus on providing MHPSS and mental health to women. So we have formed committees of the General Secretariat of the Ministry of Health and other relevant and concerned ministries to address and to provide programs. And we lack a sufficient number of psychosocial support experts and psychologists and therapists. And however, we addressed also we also I would like also to focus on to shed the light upon the cooperation, the collaboration, and the contribution of other international local NGOs who participated considerably in providing experts and therapists. As you know, like here now, the government is determined to close all IDP camps, and this closure requires us to employ and utilize every single effort and every single therapist and psychosocial support experts, and so that we can open these psychological rehabilitation centers, especially in surgeon, and also women rehabilitation centers in hospitals, and also the Osaka centers coordinated with the NDP and with the and that can provide a wide spectrum of services to the returnees and to the women, to the IDP women's, and also these are the roles that adopted by the MOH and the Iraqi government. Thank you very much, Ms. Dr. Shaima, and your experience also sheds light upon the importance of how to conduct the efforts of the government and with the other organizations and with the concerned ministries. We took also the interagency report, Isaac report, and as we said in the previous introduction, so here with a tripartite approach, and we talked about this our kind of approach, which is how to integrate the humanitarian and the development and the peace building. This aspect fields. How can the practitioners, the local practitioners, interact in order to serve this approach? Before I introduce any new approach in the community, I should have into consideration that there are tools and ways that can be utilized so that we can intervene in the issues of peace building. So here it's very important. So these intervention should be based upon, I said, on the community, or at least so the community leaders should be addressed to solve the conflicts and the contrasts, to also the local authorities and the government institutions that can address those conflicts. And all these parties should be taken into consideration and should be included and integrated within this circle. However, we should avoid any kind of marginalization in terms of those, the concerned parties. And so because here, in order to provide the services for those who need those services, however, we should consult with the community leaders, we must have a consultation with the prominent figures of the community, with the other government institutions. I would like also to highlight the importance of the importance of comprehensivity comprehensive programs or the comprehensive aspect of any program or any approach that should that can be introduced. Most of the areas we have local authorities that we have people, we have families, we have communities who lack services. So not like in an emergency way, but there is a gap in terms of the services of the humanitarian field, and then at the same time, at the same environment, the same area, we have people, we have individuals who suffer, or they are striving to be included within this development field. So we just need to have this diversity in terms of the context that we work in. So we should include all those these diversity or these groups. So it's very important here within the tools that we use within the local context. So we need to address the peace building and to address the MHPSS issues. So we just need to focus on the importance of inclusion and to include all of these the individuals and the local practitioners. And so it's very important for it's here we need to remember that these sectors need to be addressed. These communities, these vulnerable, these groups need also to be included. Any children. As for Anbar experience here, we found that the coordination between the parties, whether the government or the local authorities or the NGOs and also the volunteer groups, so also the community listen. They live on the field. They live and they know that they can identify the real and the field that we can intervene. That's why we can observe the problems and the difficulties before setting out the strategies for these governments. Of course, as you know, that every province has its own needs, its own difficulties. And in 2000, at the present time, we have similarities. However, we also have different needs and different categories of response. And sometimes we have provinces that we do not have response in terms of MHPSS or the social cohesion or peace building. Sometimes, as for the Anbar in terms of the HSPSS and the peace building, we have found also the MOH also has opened clinics and centers that can provide MHPSS services. However, also the lack of funds for the available for the MOH. Just now, the MOH is somehow is not doing its best, and that's why this needs for all the efforts of NGOs and other NGOs to work, international organizations to work with the MOH and stakeholders, and to open new scopes of collaboration with the government and with the MOH in specific, and to open a new aspects and new spaces for collaboration, discussion, and negotiation with the government. That's why here, here the policy papers and the policy notes can be discussed with the with the Prime Minister office. It can also be discussed with the Prime Minister's with the Prime Minister with the Council of Ministers, and also we have in order to sustain these efforts. So my question is to you also. So you mentioned some of the community response and the local and to consolidate, to reinforce and strengthen the integration, the coordination. How can your organization benefit from these consultancies and the cooperation in terms of peace building and MHPSS, and how can consolidate these efforts and the reports that in order to provide these services to the local communities. When I overviewed these structures, the Syria organization worked on similar guidelines on your report that have been mentioned in your report. And it also in 2022 we worked in Ambar. But also in 2017, also with the international support, we also worked with international organizations to have this note and a report on the MHPSS and PSS with the cooperation of with some NGOs, and we worked on Al Wasal program in this. And also in this program, we included the awareness and the first aid and also the mental first aid services in the IDP camps and all. We have activities. We had also activities, and we included also in the report. And this program. So we have educational. We have a program. We have a training programs within this program. Also with in the females, young girls in the IDP camps, and also in this. There was a gap between, in terms of acceptance, of accepting and the inclusion of stigmatized families, and also the families that were living in IDP camps. So here we conducted some activities in order to strengthen this acceptance and to increase the awareness and to increase the awareness of the local authorities and the host communities to accept those communities. So we had discussion sessions, and we have also dialogue sessions and circles, and which are those we combined. We brought all those families in order to foster and to strengthen the concept of accepting the others, and we also focused on the acceptance and the capacity of the housing communities to develop the IDP families, and also how to recognize their rights, those families' rights to live and to have in dignity and to have respect. Also, the hatred speeches was one of the topics that we addressed. So here we also did so in order. We also addressed the idea that though you are displaced, but you can be effective, you can be influential, you can be actors, you can be practitioners in terms of peace building. So, Dr. Abbas, you have the question here. How can organization benefit from the instructions and guidelines of the report to strengthen their efforts in this report? For orphans, all of the reports are developed by the international organization. Here, the context here adopted by IHO is to overview and to study those reports and to benefit or to collect experiences and expertise from the international organizations' experiences, and also taking into consideration the traditions and the customs that prevail of the local context, and then we can come up with the strategies that we can apply in different fields that would go in line with the Iraqi. We also coordinated with the UNFPA with the family control program, and we benefited from UNFPA experience and with the NGOs, and taken into consideration the meeting with religious leaders, influential and prominent figures in the communities, so we adopted this strategy to cope with the international trend and international standards. However, we also focused on the main idea that the local communities accept those strategies. So I also can benefit from the learned lessons. or the success stories mentioned in this report, so that we can identify the best inclusion tools and systems that we can adopt. Also, the most important and the prominent strategy challenges that we can face, and how to avoid them, and how to improve the techniques and solutions for those children. You talked about to inclusion of for other voices from the local authorities, from the local communities, and how that will also from in this inclusion we can identify the needs, we can identify the challenges, and we can the real and the actual needs and of the community. You talked about the learned lessons and the success stories, and also here in terms of the Ministry of Health, and how could you in the Ministry of Health benefit from those experiences, and the how could you benefit from those learned lessons, and then in terms of the PSSS and the peace building, so that you can benefit from those lessons, and also so that you can improve this inclusion.
We can speak first as the point of strength at the moment that we started the stability phase in Iraq, and in addition to adopt the decision makers by the government, that the Prime Minister was the Minister of the Human Rights previously. So when the decision maker in this regard is well aware of the human rights and the details, this will facilitate many things. In addition, as ministries and governments, this also started to clarify the importance of the role of the MHPSS programs in achieving peace. Also, there should be a collaboration of efforts, as my colleague Kauthar mentioned, and I support her in this regard, that there is a necessity to have a coordination and cooperation among international organizations, local ones, and governments to clarify the range of needs for each governorate. We know that there is a tribal nature, a doctrine nature, and also there is a kind of refusal, or some people consider this thing as a minor things, because 10 years ago is different from now. There is now a great acceptance of the MHPSS programs, and some are requesting me of such kind of programs because, as you may know, we have a scarcity of this issue. But with decision makers and the advisors office, we were hoping to open a new study or a new board for therapists and psychologists, but this is for the upcoming years. In addition, as a support from organizations, we hope that the support is not on a short-term programs and the program ends, and this can lead to a total collapse of the program, but as if this phase was not there. In addition, the necessity of the collaboration of the efforts when we are dealing with returnees, we will have the memories, recalling the memories, and also in July 1st or July 13th, the closing of the camps, when we provide documentations and also when we retrieve these rights, this will support the psychological health. Otherwise, we are providing psychological services, but what if he has no shelter and no documentation? As my colleague mentioned, also this will lead to a collapse of the psychological health. So now, in order to to make it or to make the story short, in order to have a clear and successful and tangible results on the ground to provide the psychological support, and all this lead that with the stability of Iraq afterwards, we want to look and seek for the stability of the human individual, and this will lead to a promising future of Iraq. Thank you, Dr. Sheima. What you have mentioned is one of the main guidance within the report, is to unify the efforts of different sectors and also of different local actors who are doing as mentioned, and also the main principle that has been mentioned by this guidance note, to integrate MHPSS and peace building within a bi-directional way, and this have been highlighted from you individually. Also, you can tell us of the learned lessons of based on your expertise and through your work based on GIZ. Just to put my reply within the context, after the conflicts, normally the path to peace is always a thorny area. And also there are some tries by some members of the community to gain their rights and also to gain or to reach justice. And these methods can be represented and fed by violence. So they will use violence to gain these rights. So this violence and this intimidation of repeating the same will be transited to another generation. One of the lessons that we have learned, if the community will not have an active methods to gain their rights, they will use this option. In many places that we have worked in, we have seen that the community tries to get tries through revenge. For example, they write on the doors of that ex-person that they are going to revenge from this house. Also, for example, there is a fence between the two or the one village due to disputes and conflicts between two components of the community which lead, and this transits from one generation to another, and this leads to a stigma among these groups. Also, we have noticed, and when we have worked with that the male and female survivors, when there is a specific entity who receives these complaints and they put these complaints within its proper location and give the proper reaction from the active concerned actors here in this regard, we will have a kind of a feeling of safety, and this feeling that you have been oppressed, this can ease the thing. These are one of the lessons that we have learned. So MHPSS in this regard is very close to the minor entities and concerned entities that they are working on peace and also working on peace building. Also, as far as concern the interventions of the psychological health in this regard are going to be many or mostly practical. Also integrating the curriculums, whether they are scientific curriculums or specific guidelines that each organization has a specific number of rules to implement. If we try to reach the methods that is existed to support such issues, definitely the results are going to be positive. In many occasions inside the projects, they were calling for example, the social reconciliators, for example, clergy people, and also they took the burden of this responsibility for beneficiaries. When the MHPSS programs explain what are the cases or we are able to assist in instead of erasing them, we had many times they refer many cases to us, whether orally or through a phone call, or even sometimes they support these MHPSS. So here, this reiterates the importance of integrating the we sometime to adapt these Western, let's say, approaches to our context in the Eastern side, and through and based on my expertise, if we implement this step smoothly and also try to implement it and take into consideration, and we do an effort in this regard, we will have a positive. Not it's not succeeded in every time, but mostly it will succeed. Thank you, Mr. Marwan. We are happy to listen through the experience and also the expertise to see this positive influence. You have mentioned many important points, but what drew my attention, the thing that you spoke about individuals who are practitioners in peace building or MHPSS, they are more aware and knowledgeable of what's happening inside the community, whether they are root causes or incentives, and also what can cause within the displacement places and the return places in order to make these interventions more effective. And also you have mentioned most importantly, away from integration and the engaging of the community instead of imposing principles and approaches that are not familiar with the community. But the idea here in this regard, not only the institutions and the organizations who are doing this task, but also there are other individuals and members of the community who have problems, and also to integrate these MHPSS as if we are completing these local efforts. So thank you very much for this response. We are almost close to the end of the panelist session. Before we end, I would like to remind our colleagues here and our colleagues through the online Zoom that if they are thinking of a specific questions through Zoom, they can write their questions within the chat box. And once we finish this panelist session, we will have a Q&A session, and also we will listen to their responses from the panel. We will move to the final question. We will start with Ms. Kauthar to conclude this topic today. You mentioned individually, and you have spoke a lot as far as concern collaboration and cooperation. So how can local authorities and local actors can effectively cooperate and collaborate in order to integrate MHPSS and peace building, and also to make a sustainable and active efforts in this regard? As an MBAR governate experience, we have social committees and community committees. Maybe we do not have a time to form a committee, the committee of the MHPSS. Maybe we don't have time, which includes peace building, because the structures are multiple, and this make a huge burden on the government and the organization, and this make a huge burden on us. But the good procedure that I believe that we can add to these committees members of the health community, because these committees lacks members of the health committee, whether from the psychological side, because they are going to be more aware, because since 2017, and also my colleagues in the Al Tadamun League, also they are aware of this issue, and they are in direct touch with our communities and committees in this regard. We lack specialists within the psychological health side in these committees. In addition, as a Suqya experience in this regard, to promote the role of education, promote the role of education through the curriculum, which can include psychological health. We had a good curriculums, but within the needs and within the situation of the crisis, we need to provide this, and to have the first aid, and also this will mitigate the burden of the organization as far as concern these topics. We will have many educational staff that they will help thousands of them. Also, we have went to schools to promote to social cohesion and MHPSS inside these schools. These topics need specialists, and considering that Ministry of Health in cooperation with the government and the community and organization, this will result to have a good outcome. We had many children that have been used through schools, through the stigma of community, and also they were intimidated to attend, and we have some teachers they refuse to do that. But through this curriculum and through this awareness, even if it is awareness through Ambar, if it is going to be generalized on the level of Iraq, on the areas of the displacement. Thank you very much. Thank you, Kauthar, and also the collaboration of the efforts can reach us to the sustainable goals, and achieving this objective within the community, it may take time, and it needs more planning and thinking in this regard. Thank you very much for you, and now we will move to Dr. Abbas. As colleagues knows, Iraq is a multicultural society with different traditions and customs, and also multi-religion community. So this topic makes the work environment in Iraq to be difficult for the local organization, especially because we should have a prior knowledge of the traditions and customs of the community, that you are going to try to implement different projects in order to guarantee the highest percentage of use of the planned project. We may see that the participation of the reports and the learned lessons, especially among local organizations, there is a huge role in this regard, but making use of the local organization that most of these organizations are from the benefited communities and they are aware of the traditions and customs. So this leads us. So the participation of these reports, in addition to the land lessons and the challenges, can play an important role, which help for coordination for the inclusion and the integration topic. Dr. Sheima, we would like to listen from you for the importance of the active or the local authorities who can collaborate the efforts for the peace building and the integration. I have mentioned previously that local organization in coordination with international organization and governments to lay the plan and the programs and forming the executive committees to state the needs of each governorate with its particularity. We are not speaking only about IDPs and returnees, but we are having many problems in the southern part of Iraq. The south part of Iraq has suffered many of the scourges of the wars. As a consequence, the Iraqi society is in a need for the psychological support in this regard. And I'll give you an example. In the office of the Prime Minister, we have received a formal letter of an opinion of the psychological impact for the case of the divorce and what can Ministry of Health can provide to stop the cases of divorce in coordination with the advisor of the psychologists, and also we have provided a question for those who are going to marry. So this question is to prevent the cases of marriage which can lead to the stability of the family and the stability of the children within the family. So the issue of the mental health and also the MHPSS programs are very important, and they are just like the physical health of the individual, and also to have a sane person, if I may say, they should be both achieved within the needs and what is needed through the CSOs, which can go to the field and also can deal with the community, can clarify the range of this need. So coordination by support of international organizations and also in coordination and collaboration with the service and the line ministries, this can achieve peace in different aspects, not only in the mental health side, but also we have a scarcity in this topic, or if I may say a lack, and this was a fuzzy area, but now we have started steps. I do not say it's a very quick responses, but they are only one step within the 1,000 mile in this regard. We will like to conclude with Mr. Marwan. Also, would like to listen from you how the local actors can achieve more sustainable result in this regard. At the beginning, I would like to say, taking into consideration the experiences that have been established since the last 20 years within the conflicts and disputes that happened in Iraq, and this suggestion for the actors who are providing mental health interventions and the uh, interventions of the organizations that I have seen on the sites, that there is a lack of use of the resources and the expertise related to the mental health, and I mean here in this regard the specialists. And there have been many tries that have been done to fill this gap. We have different departments for graduate studies which have been established, and also there are graduates. So it is important to be based on these tries to fill this gap, and instead of doing a second try, otherwise they can make use of these resources that are available. The second point, one of the second resources in this regard is the information that exists, for example, like the guideline and the interventions, and many organizations have conducted many researches and also many systems for interventions, and it has been proven as an active one. But although this all these issues, some actors who are building their projects, they are trying the same projects and the same methods that have been tried previously. I conclude with the last point. These tries and these interventions should be a long-term processes and sustainable, because most organizations are working in this field, they are mainly depending on the external financial funding. And this is good at the moment, but in one point of the time, we should shift from to have more sustainable methods and to be inspired from the community and the needs of the community and the intervention of the community itself. Thank you very much. Thank you, Mr. Marwan, and thank you for shedding light on the importance of the efforts of different local actors and how to make use of these efforts and lessons for the different individuals who are working in these two fields, which can lead to researches and also amendments and things that can help and assist to have a more sustainable way. Thank you very much again for your attendance, and thank you for your participation in this seminar. Thank you very much. And now we will move to the Q&A. We will see if we have questions from our colleagues here inside this hall, and also we can take questions from the chat box. We can start from here, our in-person attendees. Do you have a question or a particular or a specific questions to any individuals of our panelists today? Dr. Bashar, please go ahead. We will just give the mic to Dr. Bashar and then you can start. At this time also, I will check the chat box on Zoom in order to see if we have additional questions. Dr. Bashar, the floor is yours. My question to you is,
as for the MOH, I think, do you think that the curriculum in the schools and those who designed those curriculum, do you think that that these curricula target these topics, these concepts? So is there any connection between the Ministry of Education and Ministry of Health? Do you have any collaboration with the returnees and with the returning communities, specifically in the provinces that witnessed the war on ISIS, and also there are some children in the schools, and those some of those children belong to stigmatized families. Do you think that you can deal with those cases? And yes, actually, this is a very important question. Thank you very much, Doctor, for this question. We have Dr. Adnan here. He was a while ago. He was coordinating with the IOM and with the efforts of Dr. Omar and the counselor's office. We launched a strategy to a preventive strategy to prevent or to avoid committing suicide, because this phenomena has increased, in fact, in the vulnerable communities. And we have also, and we targeted the Ministry of Education, the Minister General, the Directorate of the Curriculum, and the High Judicial Council, the Religious Endowment Directorate, and also the Ministry of Youth and Sports, and also the Prime Minister Secretary, and also Mr. Adnan was working with it with this, and I would like to speak about one specific thing, is that here we focused on this, this phenomenon, this which is committing suicide. We also targeted the social media, the curriculum, and we also targeted the training programs. and we have initial meeting, and we have this Prime Minister order to incorporate and to integrate those topics into curriculum, and also we coordinated with the IOM and with them, and this is the second strategy in the Middle East, and the first strategy in the Arab homeland, and the first country to adopt such a strategy was Iraq, and we focus on many topics, and so here's the exams and the schools and the committing suicide, the suicide attempts among the students. It was one of the important topics that we dealt with in this strategy. It focused on on this phenomenon, and we and the MOH addressed the topic, the challenges, the motives, and also the reasons. Also here, also we talked about every single thing about these attempts, and even the details, technical details, such as, for example, the bridges that are used by by those who committed suicide. Also, and also we provided solutions to provide to open youth centers, and also we also addressed the TV programs and that sometimes provoke or encourage students to to commit suicide. So Dr. Adnan also would talk about this as psychological strategy. And also we will be talking about the practitioners and the active the effective actors in this respect. And I will give the floor to Dr. Adnan, that will talk about the mental health law and the amendments to this law that will be endorsed lately. Peace be upon you. So I have, my name is Dr. Adnan Sen. I'm the National Counselor for the mental health in MOH. So we had the first meeting in June on suicide attempts, and the meeting was attended by many parties and many ministries, and we had also representatives from the Ministry of Education and the Human Rights and the Directorate of Curriculum, so that we in this meeting we put the last touches and the final recommendations upon the adopting this national strategy. We have also coordinated with the public health and directorate, and with the women division in the Ministry of Women, and also we had with the Ministry of Youth, and we had training courses and programs, awareness programs to increase the public awareness of this phenomenon, which is like unfortunately this phenomenon has increased lately in the Iraqi communities. And also, this within the Iraqi context, we talked about all the effects and the reasons, the motives of such a phenomenon. Now, also, we are coordinating with other parties, and also with we are planning to coordinate with the Ministry of Education to have joint activities. And also, we're now in Baghdad, we are also coordinating with the Ministry of Education, and we are applying, and we are using programs, and this thank you, Bertrand. So because of time limitations, please, if you have just specific questions. So we have two more questions over there from chat or from Zoom link. The first question is from Abdul Karim Khader. So I don't know if I pronounce the name correctly. So what are the tools that to integrate the MHPSS services with the peace building? So how can this integration be completed, and how can the health sector intervene in this integration? So So can you just talk about those mechanisms, those techniques that you use in the health sector? As for the mechanism that we use, we apply, so to ensure the integration, so we have more than one mechanism. However, we can say that the most important one we can say that should start with is the increase the public awareness regarding peace building and MHPSS or the mental health services. So this is the most important point that we use, so that if if we are going to use, go into the path of, integrating those services and with the health sector, then we will have some hazy or some vague, unclear spaces or sometimes fields or mechanisms. However, but we can apply this. We can start with this strategy, with this mechanism, so that to avoid such vagueness and clarity. However, also, so in order to proceed with the practical steps, we can ensure that Dr. Abbas. Also, we have also one question from in the chat. This question is directed to Kauthar and Mr. Muratwan. So you also talked about certain issues about how to include, how to integrate all the groups of the community. So the question is from Abdul Karim Khadara, and so he's asking about this stigma and how to reduce the effects of stigmatization on the subject. Generally speaking, we start with the case. So because we listen to the case, to the stigmatized person also, and also we can we study all the effects and we assist the case with the legal assistance and with the legal services, and also we see if the case or the person, the individual is still under the effect or is still under threat, and also to provide a protection to that individual and to increase the individual's awareness of the legal assistance and of also the health services that we can provide, and the current services that the individual can get, and also we can the individual is taught how to integrate into the community, and how to access the services, the current services, all the available services, and also to increase the individual's awareness of the rights that he or she has. Also, Mr. Marwan, if you can intervene on this subject, can you just repeat the question, and how the mechanism of how to treat the stigma cases, and how to reduce the effects of stigmatization on children? I do not know an exact or a well-defined strategy or mechanism. However, we have so many efforts. So here, for according to my experience, and then so some of the survivors, the female or male survivors, returned. We had a exorbitant number of survived females. Female survivors who were detained and captivated by ISIS, and then we adopted many efforts and mechanisms. So also one of the mechanisms that we before we assess the need, and we adopted the need as assessment strategies. So here because each survivor has its own way of dealing or treatment, and then each one has her own needs, and that's why in this strategy or this mechanism we identify the needs and the suffer based on the suffering that this woman or female has been through. So the most important prompting is how to adapt with the new environment, with the new community. So here we planned for we have an intervention plan, and we increase the public awareness, and we tried. And as for the survivors, they were not these things were not like the basic needs The basic need was how to teach me how to adopt and how to adapt to live or to start a new life in the community. So we coordinate with some of our partners and also so that we ensure the provision of such services to those survivors in their community, host community. Thank you very much, Mr. Moses. So specifically focusing on the individual needs and individual differences. And thank you for all your participation, for your intervention, for all suggestions, and thank you very much. And now we move to I welcome Amal Abbas from the psychological the MHPSS subset and the IOM in the office of Iraq to provide us a model of how to cooperate, to coordinate with other sectors, and to consolidate all the efforts to strengthen the social cohesion and the livelihoods and the integration.
Thank you very much. Hello, everyone. At the beginning, I would like to thank colleagues from IOM Ukraine for her support in preparing this PowerPoint presentation. This presentation is going to be dedicated with the livelihoods and also the MHPSS and livelihood integration. The support of the program is a comprehensive for the psychological and MHPSS support and peace building. Previously, we were focusing on social and common social issues and the social cohesion. As an example, the tensions for the return of the IDPs, especially at the current moment after the closure of the camps, and also the acceptance of the returnees of the perceived affiliation, and also the incapacity of reaching to the basic needs. This is the MLI map, and for the MLI for community stabilization and peace building. In the next slide, this is the timeline that we started in 2020 to have the needs assessment for the MHPSS, and also the first pilot training that started in Mosul and Kirkuk and Basra governorates, and the continued programming and manual development in another areas, and also the development of the manual for the MHPSS, which lasted from 21 to 2022. After that, collaboration between MHPSS and livelihood project teams was continued on higher, which included different projects in livelihood means in order to integrate MHPSS and MLI, which included to work for cash and also the individual help. In 2023, this have been developed to the graduation project in this regard for the issue. What is MLI here in this regard with the livelihood means? It's a collaboration between MHPSS and livelihood project teams based on needs assessment findings to integrate MHPSS services into livelihood projects. MHPSS services are provided based on the MHPSS and livelihood integration manual, which is published on IOM page, developed by IOM, and there is a hard copy also available to you here, dear ladies and gentlemen. Also, this integration and integrated support included to have an MHPSS awareness sessions, and also at the end to have a 15 minutes questionnaire that we can make the beneficiaries to take the decision for the topics and what they have introduced and understood of MHPSS and what do they need, and also the topics that have been mentioned in the manual to be listed and to be selected by the participants. What is the skill that they would like to be introduced more, and then they choose them. And also we have also the peer support groups in case if they need an individual support for the related to the project, or to support the specialization more with social workers and therapists from the mental health, or maybe referral to other services that can help them in this regard. objectives and benefits of MLI. Definitely the first step and the main issue is to minimize or mitigate managing work-related and other psychosocial stressors and strengthen positive coping mechanism, and also to be adapt and also to adopt the positive coping mechanisms, also promoting positive outcomes, and also at the same time people who are inside the camps to have a motivation to have a specific skills which they can work on, a skill that they can work on, and also enhancing self and community efficiency, and also the social resilience, and the MLI processes in different settings as far as concern the urban and rural sides. First of all, there is a coordinate MHPSS livelihood, and then we agree when we start the awareness session, and then we start with the peer support groups, and then we have the individual counseling based on request, and on we have the referrals for more specialized services or any minority services, and we end that with the focus group discussions where the participants we can get from them quotes and feedbacks on things and the skills that they have made use of, and also we can have recommendations for the next groups that how we can develop these things. As far as concern the camps, the uh, MHPSS that is going to be responsible for the support at the beginning. There is a support and then registration and verification in this regard. After that awareness session for the peer support, you have a more focused group discussions. After that integration with the MLI, we had a minor difference between the people who have been selected within the individual or independent livelihood means not only one person to be dependent. So here what we start is to evaluate, assess the needs for the families, and also to develop a plan for the family and the type of suitable intervention for them, and also an awareness session for mental health, and also we select topics for the peer supports and the psychological support and the individual counseling based on request, and also at the same time we develop a plan related to children, teenagers, and also what they need. We can do that in the form of groups or individual counseling. Results. After 3 years of implementing the program, we had a positive or many positive results. For example, how to build the trust, to have a confidence and evaluation, and also to increase the motivation, and also to more interaction with others and more relations and group work, and also the capacity to make use of the opportunities related to work. Women also leading a project and they're responsible for it, and also providing more opportunities to adapt with a new situation or any difficult with more positive outcomes. What has worked well is through the context of the camp of the community trust based on the and also it provided hope and the value of the individual, and also I will have a specific skills when I return, and I will make, and also we have positive adaptation skills if they do not face, and if they face difficulties, how to adapt. Normally this also promoted and enhanced the fragile components, whether they are minorities or the children without parents or elderly people. This was easy for them to reach, also for people with a stigma, how to reach this psychological support through MLI. This was reached easily. For the rural and urban, the peer sessions groups also provided to express their feelings and the expertise that make use for them, and also it strengthens the relationships and also the social bonds, and also awareness and its role in the community awareness in general, especially within the graduation project, and also with the members of the families, and also it provided also give them much more better results, how to develop their words. What has been difficult in this regard is the funding for the mental health. Unfortunately, it is less in this regard, which will make the job harder and also to have a more constant interventions and more regular interventions. Also, the ability to reach the services and holding the sessions, especially for those who are from the rural areas and difficulties to reach, and also we will have different programs with a limited numbers of individuals for a specific limited activities. As best practices from Iraq, in a nutshell, we have adapted the sessions for the mental health support and also based on age group and sex as well. And also we had the comprehensive access to the MHPSS, and this is based on how to be referred to a more specialized, and also the facilitators who have good information as far as concern the MHPSS and their capacities to identify the needs. If they need a more specialized intervention in camps, normally engage people who are already trainers and volunteers in order to make the project successful. Again, the communication and the constant cooperation between the MHPSS and also the livelihood teams. Integrating the MHPSS needs to have a comprehensive assessment based on the life means and peace building. It provides a safe space for the social and the community support and to feel that they are related and bonded to the community, and this is within the peace community. Finally, integrating MHPSS with peace building and livelihood, this will support the collaboration of the social cohesion. In the final slide, as you can see, dear ladies and gentlemen, the final slide, you can see here that there are links who have been published related to the MHPSS and the guidance and also the cooking book that have been used for recipes and also the evaluation. The success stories have been published on the IOM page. You can read through here, and also the guidance is here available in a hard copy, and also it is also available for my colleagues on online as a soft copy. Thank you very much. Thank you, Aman. Now we are reaching the end of the activity for today. In conclusion, we would like to remind you that integrating MHPSS with peace building is a vital process that should be a bi-directional way, and it should include many sectors and many actors like the governments, NGOs, and the local community, as well as expertise who are related to mental health and also in peace building. I would like to call everyone to continue their efforts and to continue their discussion for these important directions and to elaborate the efforts to have more clarification, collaboration. We can have a more sustainable and resilient communities who can everyone live in peace and dignity. Thank you very much for your attendance today here in this hall, and also thank you for our colleagues who have attended through Zoom. Thank you very much.